We are back with Dr. Evelyn Lomasney with Cone Health Allergy and Asthma Center of North Carolina. We're talking about how to manage your food allergies, and oral immunotherapy is something that Cone Health does, and you've had success with it. So let's talk about what it is and who might be a really good candidate for it.
Sure. Oral immunotherapy, or OIT as we call it. Basically, what we're doing is we're giving patients micro doses of what they're allergic to retrain their immune system. So instead of reacting to the food in an allergic way, we give them tolerance to it. And how that works is on a day one is about a 4-hour appointment, and you get increasing doses every 30 minutes. And then you go home and you dose at home. And then every week you come in for about 18 weeks and we up dose you until we get you eating what we call maintenance dose. So for example, for peanuts, that's the 8 peanuts a day. After that, over time, we allow people to freely eat. So as long as they're eating their maintenance dose, they can have a Reese's, peanut butter cup on Halloween. And then over time, slowly those maintenance doses can be reduced, but that is very much kind of an art to the practice. But we do it for most foods, and we've had great success. Our OIT program has been around for since 2019, and we work with a national organization of board-certified allergists who've been doing this in their practice for much longer than that with great success.
I mean, what a cool...
Who do I recommend OIT? Someone who is highly motivated. Those first 18 weeks is a lot of work on parents and patients. So someone who's highly motivated to eat the food, or very worried about cross-contamination. Because if you're eating 8 peanuts a day, cross-contamination doesn't matter. So it's really got to be families that are comfortable with the idea of this, because there are risks, and who are motivated to do it.
Right. I was going to say, it's the coolest thing to think that you wouldn't have to be so worried about some exposure, that kind of thing with this. So you kind of mentioned that there are risks. What are those risks, and how do families decide when to consider it?
So the biggest risk we talk about is the risk of allergic reactions. We do this in a controlled, protocolized way, but that risk is never zero. So the family has to be comfortable with treating allergic reactions if they happen. We do have someone on call 24/7 for our OIT patients to help handle that, but that risk is there. The other thing we see is patients, especially some of our teenage patients, can get frustrated of having to eat their maintenance dose every day. So it is one of those things where you can skip a day of medicine and nothing may happen, but if you're skipping your OIT maintenance doses, you can lose that tolerance. So it can become kind of burdensome to some patients, and I think that goes back to the motivation.
Gotcha. Okay, you have to really want to be able to do that. I gotcha. Okay. Thank you for your time and your expertise. This is something that reaches so many of us. If you want to see this interview again, maybe you want to send it to a friend or a family member, it's going to be in the To Your Well-Being section of our website.